Hey y'all, Dr. Johnson here, your friendly neighborhood medical marijuana doctor. There will be two videos on tetrahydrocannabivarin, or THCV, because it's a really unique minor cannabinoid. It tends to be found in the racier sativas like Durban Poison, and this video will go over its activity at CB1 and CB2 receptors, the traditionally thought of endocannabinoid receptors in our body. And the second video will go over its activity at a couple other receptors that we know about so far, although the data is still lacking. I'm going to start with a very black and white simple explanation and then go into a little bit of detail as to why. At lower doses, THCV appears to reduce the psychoactivity of THC. At mid-range to higher doses, THCV appears to become an agonist, not an antagonist, at the CB1 receptor. So it begins to show at high doses THC-like effects rather than blocking it. The longer biochemical story is that THCV acts as what's called a neutral antagonist, which means that without THC, or let's say our native cannabinoid, anandamide, an agonist of CB1 floating around, it doesn't really have any activity at the CB1 receptor. But when you have, say, THC or another CB1 agonist on board, THCV actively blocks the activity at the CB1 receptor, at least at low doses, so below 25 milligrams. At higher doses, there's both mouse evidence and human clinical trial evidence now that THCV does act as an agonist or an upregulator at the CB1 receptor. So there was one really cool to read about human clinical trial that showed using several different doses that at the 100 milligram and 200 milligram oral dose with THCV, those patients did report drug-like effects, or I assume the stoning effects of agonism at the CB1 receptor. Interestingly, 78 out of the 79 subjects in their post-dose urine specimens were positive for THC, which means that THC must break down into a similar metabolite that we test for in the urine drug screens. Also interestingly, several of the doses showed in several of the patients an improved sustained attention span, but it was not dose-dependent, which makes me think that maybe some of the more neurologically ADHD skewed folks are the ones that benefited at different doses from this, and perhaps THC does increase focus through endocannabinoid receptor activity. Last thing before I go to part 2. THCV is advertised in several places that I have seen as a potential appetite suppressant. There is not human data that shows THCV is an appetite suppressant or offers any sort of help to lose weight. There just is not. THCV is a partial agonist at the CB2 receptors, which means it basically just doesn't activate that receptor as much as, say, a full agonist like THC might. That means it does have a potential as a neuroprotectant or anti-inflammatory agent from that perspective. So just to wrap up, what do we know for sure? THCV has activity at TRPA and TRPV channels, so pain relief, especially for neurogenic inflammation. We know at lower doses, it appears to reduce THC's psychoactivity and not be psychoactive itself. At higher doses, in the study it was 100 milligrams and 200 milligrams, it appears to show THC-like effects. The evidence is super duper limited for claims like improved focus, which is only shown in one study for select individuals and was not dose dependent. Its potential as a neuroprotectant or anti-inflammatory agent through CB2 activity due to its only partial agonism, and its potential for any of the effects like pain relief from the very understudied GPR55 cannabinoid receptor.